Hello everybody, welcome back to our channel Nursing Career Club. Today we will discuss about Home Health Aid Unit 11, Care Plan Implementation and Fall Prevention. Introduction. As a home health aide with a focus on fall prevention, your role is crucial in ensuring the safety and well-being of your clients, particularly those who are elderly or have mobility issues. So if we talk about home health and responsibilities. So, AHHA plays a crucial role in the mobility of the patients who are aged and elderly in their age. So, the HHA helps them to move from one place to another place with the help of the wheelchairs and stretchers and any other equipments. Definition: unexpected falling down from high position to low position with or without injury due to physical or mental effect. If a person falls down due to the mental and physical inability, then he or she got injured. So this is very mandatory to protect them from falling down, and these all are the responsibilities of a HHA to secure them with the fall prevention. Near fall, sudden loss of balance with incomplete fall, which includes slip, stumbles, or strip with ability to control. Near fall can be defined as if a person loses the balance to walk properly, then he slide or slip down on the wet floor. If a person is walking on the wet floor, then he slips down and fall down or strip with ability to control. So AHHA needs to be help the patients in walking at the various floors so that the patients can be moved from one place to another place. Most cause of falling. Now we will talk about various causes of falling. Loss of consciousness. If a person cannot concentrate his or her mind on his or her viewpoints, then he loses his control and falls down due to loss of consciousness. Orthopedic disorder. If a person has problems in his or her legs or hands, a orthopedic problem and an orthopedic disorder, then he can fall down. Hypoglycemia. This is also a disorder which is related to joint diseases. So then, because of this disorder, a man or women can fall down. Anemia vision, and due to the anemia, if a person is suffering from the anemia, then he can fall down due to the weakness of his or her body. And vision problem, if a person is unable to see particularly, then he can fall down. Hypotension, this is also a disorder which is related to the fall prevention. Drug action, if a person is affected by various drugs, then he loses his control and fall down. Post operative sedation, and a person who is operated recently, so due to the weakness he or she can fall down. Aging and sleeping habits, if an aged person or elderly person who is walking on the floor or on the road, so due to the weakness in his or her body, he or she can fall down. And due to the sleep habits, paralysis, If a person is suffering from paralysis, then he can fall down easily. So, a HHA should be able to protect them from the falling conditions. The equipment necessary for the implementing the care plan. First one is medical monitoring equipment, vital sign monitors, glucometer, thermometer, weight machine, activity monitors, fall prevention and detection devices, wound care monitoring tools. So these all are the medical monitoring equipments which are very necessary for the particular treatment of the patient and for the particular tests of the patient's body. Now we will talk about mobility aids. Types of mobility aids for seniors: cane, walker, rollator, manual wheelchair, power scooter. These all equipments are very mandatory for the mobility of a person from one place to another place who cannot walk. So, with the help of these equipments, the person can walk easily. The equipment necessary for the implementing the care plan: safety and fall prevention equipment. There are some safety and fall prevention equipments: personal protective equipment PPE, harnesses and fall arrest systems, guardrails and handrails, safety nets, non-slip surfaces, safety signs and labels, guardrails and handrails. A person can walk with the help of the guardrails and handrails with a safety without any hesitation. Safety nets Safety nets are also used as the protective equipment for the falling prevention, non-slip surfaces, and the surfaces are should be in a good condition so that a person cannot slip on that surfaces and he or she can walk without any hindrance. Safety signs and labels. There should be safety signs. If we see on the roads, there are various signs. Some indicate that we should walk slow, and some signs indicate that we should walk fastly, and some signs indicate that we should move left. So these all are the safety signs and labels. Wound care supplies. If we talk about the treatment of a wounded person, then some accessories are necessary for the wounded person, like a scissors, syringe, and bandages, are and various Medicare management systems. So these all are very mandatory for the treatment of a wounded person. Medication administration equipment. There are some administration equipment. Medication administration equipment typically includes a variety of tools and devices used by healthcare professionals to safely administer medication to patients. So the medication administration equipments like the seizure, syringe, and any other equipments which are very necessary for the administration of the medication to the patients. And with the help of these equipments, a patient can be treated as soon as possible. Here are some common types of equipment used: syringes, needles, interventions, IV administration sets. Now we are talking about the syringes, needles, interventions. These equipments and these accessories are very necessary for the fast treatment of a patient, and with the help of syringe, a HHA gives various doses to the patient with the help of needle. So this is all about medication administration equipment, respiratory support equipment. Now we will talk about the respiratory support equipment. Now, for the respiratory support equipment, an oxygen pipe is used, and the CPR is also used for the respiratory support. The patients who are unable to take oxygen, which are needed the respiratory support equipment. Patient comfort and support equipment. Some equipments are for the comfort and for the support of the patients, which are as follows: hospital beds. Hospital beds are very necessary to give the comfort to the patients. They have proper cushions and pillows, mattresses and mattress overlays, and along with the hospital bed there are mattresses which are very necessary to protect the patient from any other infectious disease. Patient lifts and transfer aids, and patient lifts and transfer aids are very necessary for the mobility of the patients. Wheelchairs and mobility aids. Wheelchairs are used for the mobilization of the patient from one place to another place, and mobility aids are also mandatory for the transfer of the patient from one place to another place. Pillows and positioning aids. Pillows give comfort to the patients, and positioning aids are also very comfortable for the patients. Recliners and comfort chairs. These equipments are also very supportive for the patients. Entertainment and distraction devices. If we will talk about entertainment and distraction devices, such as TV and any other multimedia devices which are used in the hospital wards for the distraction of the patients, so that they can distract their mind from the disease for some time for the fast recovery. Eighth one is diagnostic equipment. Diagnostic equipment such as X-ray machine, MRI, CT scan, and any other equipments which are used for the diagnosis for the patients. So this is all about diagnostic equipments. Action in the event of a fall incident. Assess the situation. Safety first, evaluate the scene, assess themes, call for help, provide initial care. Safety first. If a person working in a with a organization or in a factory, then he or she should be aware with the safety first, because they need to be safe in each and every situation. Evaluate the scene, and they should also evaluate the scene and assess themes, call for help. If there is any hazardous moment, then they should call for help, provide initial care. If a person injured, then should be provided the first aid for the recovery of the injury. Ensure safety. So first of all, it is very mandatory to keep maintaining the safety vision, and a person always keep in his or her mind the safety purposes. Provide immediate assistance. He expected immediate assistance from the allies. At the same time, we must ensure that there is adequate protection for victims and witnesses through immediate assistance. And a person has expectation from the HHA and nurses that they will provide him or her a particular treatment and particular medicare for the fast recovery of the disease or injury. At the same time, a HHA should ensure that the proper protection for the injury and proper medicare for that injury. As a matter of fact, we are faced with sad situation since we need to debate a request for immediate assistance. And in an emergency of the injury, the person should be aware to the first aid contact number, then he or she should call for the help, then the team of doctors and HHA will come there and treat the patient as soon as possible. Check for injuries, and the doctor and HHA will check for the injuries. At which part of the body is injured, and what are the symptoms of injury. After that, they will clean the wounded place, and they will use the proper medication for that injured part, and they will also use a bandage for the same. Notify healthcare providers. Notify the treating medical provider at the time of the incident and schedule an interdisciplinary review of the patient's care. And in the emergency of injury, we should inform the doctors and HHA for the treatment. At handover, inform all clinic team members about the incident and changes to the care plan and possible investigation process. Notify family in accordance with your hospital's policy. And the injured person should be aware that he or she has to inform his or her family along with the doctors and in the accordance of the hospitals. Initiate first aid if necessary. And for the injured person, the first aid is very necessary for the short comfort to that injury. After that, the person will be taken to the hospital for the another treatment. So first aid is for the short comfort. After that, the treatment will be started as soon as possible. Assist with documentation. If injuries have occurred from a fall, document specific details of the injury. If a person injured by the falling down on the floor or on the roads, then the documentation should be prepared on the basis of that incident and the type of that incident, such as location, describe the wound, laceration, abrasion, contusion, where is the wound or injury located, and the place of the injury, at which part of the body is injury occurred. This will be mentioned in the document, and after that the doctor will take a proper action for the treatment of that injury. Implement preventive measures. We should implement the preventive measures. Risk management, identify, assess, and control hazards. We should use safety equipments like a safety cap and safety shoes and safety belts while working in our working place. So these all are very mandatory to use at the working place to keep ourselves from any injurious incidents. Assess the situation. A hazardous situation is a circumstance that exposes people, property, or environment to one or more hazardous. A hazardous situation is very effective for any person who is working at the working place. It can impart a deep action on the people or on the property. A related concept to understand in this context is foreseeable sequence of events, and this concept is related to the proper safety for the persons who are working in a factory. So they should use the safety belts and safety shoes, and also they should use the safety cap. Second one is stay calm and reassure. And a person should stay calm. A person should be remain calm and reassure the satisfaction with the treatment which is done by the doctors and HHAs. Call for assistance. They help patients with tasks such as bathing, dressing, and eating. They also assist with taking patients' temperature, blood pressure, pulse, and respiration. If we will ask for help, then the HHA will help the patient in bathing, dressing, and eating. They will also assist with taking the patient's temperature with the thermometer, blood pressure with the BP instrument, pulses with the pulse instrument, and respiration with the respiratory instrument. Additionally, they assist with preparing and administering medications, collecting specimens for lab tests. And in addition to these all equipments, they also prepare the medical documents, and they also provide the proper medication for the injurious part of the body, assist the individual, and a HHA also assist the individual in eating, in drinking, and in bathing, and in mobility from one place to another place. Check for injuries. Look for unequal pupils because a difference in size almost always indicates a medical emergency. We should look the injurious part of our body and what is the effect on that part of our body, in how much quantity the blood is flowing. So we should use an equipment to protect the blood flow. Check the chest and abdomen for cuts, bruises, penetrations, and embedded objects. And we should also check the chest and also check for our abdomen if there is any cut, any bruises, and penetration in that part of our body. So we should remove that object from our body to protect from the flowing of the blood. Maintain immobilization. We should also maintain the immobilization. Monitor vital signs. Hospitals have various methods for monitoring patients' vital signs. Some facilities use biometric devices to track heart rate, blood pressure, temperature, and respiration. And what are the vital signs? Vital signs are the body symptoms of a patient. As we talk about the blood pressure, and we also talk about the heart rate and about the temperature and about the respiration. So these all things are related to the vital signs. Provide first aid, and first aid is very necessary for the initial treatment for the patient, and the patient can feel relaxed at that moment. Thank you for watching this video. I hope that this video will be very helpful for you, and if you want to ask a question, then you can comment in our comment section. And if you want to take our note, then you can visit on our official website www.nursingcareerclub.com. Please like, share and subscribe our channel, and we will see you in the next video.